before you turn 65, unless you have a serious medical illness, you are on your own as far as getting insurance. So you have to either pay for it privately, or most people get an insurance policy through their employer, or you can get it independently, and that will allow you to go and see a different set of doctors. If there's no funds at all, very often you just have to go to public clinics with big lines, limited formularies, a few clinicians, and get the best care that you can in that system. Or just show up to an emergency room, which is a big crisis in America, because patients with no insurance show up in an emergency room and we will not turn anyone away in an emergency room. So they get free care, but the facility doesn't get paid, and it's just kind of the cost of doing business, trying to stay into business, getting money from the private payers and getting no money from those that have no insurance.
We're in Texas to learn about the US healthcare system and to catch a ride with one of our US sales representatives. We start our ride with picking up Trintellix and Rexulti packages at the local storage.
My name is Laura Triana, and I am a senior account manager in the Dallas area. I work for the beta side, and what that means is that I have both Rexulti and Trintellix, but I have Rexulti in the first position, meaning that I have more weighted accountability on Rexulti. One of the biggest challenges in pharmaceutical sales is actually getting time with the physicians. Typically you have 30 seconds to a couple of minutes to get your detail across. If I only had 30 seconds to present Trintellix to my physicians, the first thing I would do is make sure that the physicians were clear on the Trintellix patient type, and I would use this page. If I had a little more time, I would go directly to efficacy. If I had a couple more seconds, I would certainly go into the tolerability and side effect profile and how clean that is for Trintellix. I feel like the response for Trintellix and Rexulti are extremely positive. Hardly ever do I hear that the products are not efficacious or that they are not tolerated well. I feel like the number one complaint over our products would be more the coverage and the not understanding of managed care. Is it covered or is it not?
The challenge to treatment is big financially, mainly. It's trying to get these insurance companies to authorize the medications or have it on the formularies. So when you go to the public sector and these mental health clinics that are sponsored by the government, very often they have quite restricted formularies, and you can't give the newer and sometimes better medications.
But there are also non-financial challenges.
In the United States, only 50% of patients that have depression ever get treated. And when they're treated, usually they're undertreated and stop the medications too soon or don't continue therapy. And in large part, it's because I don't think people do understand depression, to be honest. I mean, they know people are sad. Very often, it's misunderstood as being lazy or not caring or not motivated when it really is an illness. And I don't think the public is that aware of it. I don't think physicians are aware of it enough. And we need to really share that with our patients and with their spouses and other family members to educate them about the illness. I think that's a big area of concern, that it's sort of what we call the Ronald Reagan approach to mental health. Just pull yourself up by your bootstraps and just move on, when it's an illness that we're often not able to do that. We've got a lot of good antidepressants and other different somatic therapies, like electroconvulsive therapy and this new ketamine therapy that may be available, and vagal nerve stimulation and transcranial magnetic stimulation. So lots of different things we can do besides medicines, but medicines seem to be where we need a little more energy because they work very well for a lot of patients, but still, the first medication you give a patient, only 27% get well. That's not good enough. And you do the next batch and then less than that get well. So there are many patients that the medications work for, but also a large group that you have to keep trying over and over different medications. We need medications that have new mechanisms of action that work differently than what we have out now. Totally different mechanisms of action, and a lot of research in that area.
The relationship is really the most important part of the sales process, when the physician trusts you and knows you and sees you as a resource, wants to talk to you, wants to hear more about your product. That is probably the strongest asset a representative can have.